start out with the Pledge of Allegiance. This time, we will do the roll call. Sheila, if you're on, please.
Yep. Dr. Hans?
Here.
Mr. Torres?
I'm here.
Are you remote, Mr. Torres?
Yes, remote in Waterford, Michigan.
Thank you. Mr. Furman?
Present for Michigan, virtually.
Miss Newman? Thank you. Miss Newman?
Present in the building.
Thank you. Miss Root?
Here in Rochester, Michigan.
Thank you. Miss Namie Dyer? Miss Namie Dyer? Dr. Guadalupe? Mr. Lindemere?
Here in Waterford, Michigan.
Mr. Cowan?
Present, Royal Oak, Michigan.
Miss Bernard? Dr. Taub?
Here.
Mr. Landsman?
Here in our offices.
Thank you.
Thank you. It looks like we do have a quorum, so we'll move on. Next item on the agenda is the approval of the board meeting agenda. So I'll look for a motion to approve the meeting agenda.
I'll make the motion to approve this meeting agenda for tonight.
Thank you, Ms. Newman. Is there a second?
Second. It's Adam.
Okay, I received seconds from both Dr. Bajaya, right? Dr. Hans, as well as Anna Furman. All right, is there any discussion? Hearing none, we do a roll call vote.
Dr. Hans?
Yes.
Mr. Torres?
Yes.
Miss Furman? Mr. Furman?
Yes.
Miss Newman?
Yes.
Miss Root?
Yes.
Miss Namie Dyer? She did notify me that she is in the meeting. Her mic is not working. So, Dr. Guadalupe? Mr. Lindemere?
Here. Or yes.
Mr. Cowan?
Yes.
Dr. Taub?
Here.
Mr. Landsman?
Yes. Looks like the motion carries. Next item on the agenda is our public comment. We have one at the start of the meeting. We have one at the end of the meeting. Is there anyone on the list for public comment?
We do not have public comment this evening.
All right, thank you. Moving on is one of my favorites. It's the Stories That Inspire. Tonight, that is being done from one of our premier SUD service providers, Therapeutics. So I'd like to welcome you guys, Deidre Goldsmith and Kristen Lee. And the floor is yours.
Thank you.
I believe you're on mute.
I'm sorry. I have two microphones here. I'd like
and
to
we can hear you now.
Okay. I'd like to give the floor to Kristen Lee, who's a member of our team, we are very proud of. Kristen, please start and tell your story.
Okay. Hi, my name is Kristen, and I was one of the first clients at Therapeutics. I came into Therapeutics in 2014, and when I came into Therapeutics, I was pregnant, and I was on methadone, and I had just graduated from law school. I'll go back a little bit and tell you the role that before I came to Therapeutics, how MAT came into my life. I was pregnant with my second child, and I could not stop using. I absolutely could not stop using. I didn't know what to do, and I called Access in Ann Arbor, and they told me that since I was pregnant and I was an IV drug user, that they had 24 hours to get me in somewhere. So they got me into an MAT program in Ypsilanti. And when I first signed up for MAT, I didn't really take it seriously. I didn't change my behaviors. Today in group, I was just talking about how in order for it to work, it's not only just the medication, but it has to work in conjunction with both therapy and counseling. It doesn't just work with the medication. It's not just a dose and go program, and you have to actually work on changing your behaviors. And I did not change those behaviors. In fact, I went to jail in my first couple months in MAT. And I don't know what hit me, what that moment of clarity was, but I finally had a moment of clarity, and I decided, I really need to do this. Something needs to change. I cannot continue to live like this anymore. And I decided, I made a decision right then and there that I was going to try to stay clean. I stayed clean for a few years, and once again, those old using behaviors started again, and I went back out. And I went back out for one day, and by the grace of God, I was lucky enough to walk back through the doors. I came back into the program, and I was able to finish college. I graduated from Eastern Michigan, magna cum laude with a BSW, and I decided I wanted to go to law school. I had a really hard time getting into law school because of my background. I had to be monitored by the Lawyers and Judges Assistance Program, and I had to jump through all these hoops and, do all these things, but I did them. And I graduated from law school. It took me 5 years. I went part-time, but I did it. And I graduated with a 3.0. And then after law school, I started working for Therapeutics as a peer recovery coach, because I had my third child when I came into Therapeutics in 2014, and I started working for them as a peer recovery coach. It gave me a chance to really give back to the community, and it gave me a chance to connect with clients and to tell my story, and to help them realize that there was a better way of life. There was a better way to do things. After that, I became a case manager, and I loved that job. I loved being able to connect clients to resources within the community. I love being able to connect clients with transportation. Transportation is a huge barrier when it comes to access to MAT. It's an outpatient program, and a lot of us, when we come into recovery, we don't have cars. We don't have transportation. We don't have a way to get to an outpatient program. So I really enjoyed being able to, run that program and being able to connect clients with, with those resources. And I decided to apply for my MCBAP development plan, and I went into counseling, and that's just where I think I really took off. And I love being a counselor. I wear several different hats. I facilitate groups. And groups are huge. Groups help, during the pandemic, a lot of us were in isolation. A lot of us were isolated from our supports. A lot of us were isolated from the community. And so group gives people a chance to connect with their peers. It gives people a chance to develop that accountability through consistent attendance. I recommend to people that they pick a group that they like and they stick with it and they make it their home group. So that way, when they don't show up, people ask, people say, where were you? Were you okay? Why weren't you here? And you start making commitments to that group. You start saying, this week I make a commitment to, I don't have a PCP. This week I'm gonna make an appointment with the primary care physician and I'm gonna stick with it. And so, I absolutely love facilitating groups because it gives clients a chance to make those commitments and to establish accountability through consistency. I also do the MAT jail program, which I do it in the Monroe County Jail and also in the Washtenaw County Jail. I'm finding that in Monroe, a lot of these clients, they come from families where the entire family was addicted. The entire family was addicted. So, it's really important that we grab these clients while we can, because there aren't very many resources in that community, and we show them that there's a better way of life and we connect them to these services. So I'm also entering my MSW program in the fall at BGSU, and that's my story.
Thank you, Kristen. So briefly, I just wanted to touch on therapeutics, our mission and our vision. I know we are limited in time, but obviously professionalism and respect for people is very paramount for us. The interdisciplinary approach to recovery, we emphasize. We've also created an R3 index, which attempts to quantify recovery by giving a number to it. The agency leadership is very flat, so we are approachable by all of our partners as well as our clients. Our medical director is an anesthesiologist who is very well acquainted with working with this population. The services we provide are obviously MAT in a very professional, prompt, and confidential way. We're very respectful of people. We're very flexible as to what their needs are. We also service about 50 MAT clients in the jails. The capacity of the jails is 200. We also we have the capacity to service about 500 medication-assisted treatment clients as well. Therapeutics, the MAT clinics are located in Ann Arbor and Walled Lake. We are also looking to open in Pontiac as well. The clinics, there's always a stigma with the clinics in that they're in terrible neighborhoods or they're not approachable by, the general public. We strive to make our clinics very nice, very comfortable, colorful, very positive for the clients that we serve. We also engage in community engagement, and this is where I want to hand it over to Kristen.
So I talked a little bit about community engagement previously when I talked about what we do in the jail. And we also, we serve a diverse population across all different kinds of socioeconomic and racial backgrounds. This disease, it knows no socioeconomic status or no racial, everybody's affected. So we serve everybody. We go into communities, we target challenged communities, and what we mean by that is we find communities that are really affected by this epidemic, and we go in and we set up, and we target these communities, and we our jail programs have enabled our inmates to have access to MAT, which is crucial. It's really important. Not only does it help the inmates, but it helps the community because number one, it helps the corrections officers. A lot of these inmates were going through withdrawals and doing things like throwing feces at the wall. So, we get them on their medication, we get them stabilized, and then when they go out into the community, they're hooked up into treatment, and it lowers recidivism. It lowers, the chances of them committing another crime, which is huge, and that's a huge service to the community. Like I said, we provide group therapy that helps curb isolation for our client community. And one neat thing that we've done is we've created several applications that assist other providers in connecting with their clients. And we've created video content. We've created a text application where clients can text a number or text a word to a certain number, and automatically, a video will pop up, an educational video. And we have another thing that we've really done is we have developed a telehealth system. Clients a lot of times their willingness to engage can be lacking. So we've decided that we are going to give them the engagement that they need. When they walk through the door, we usher them into a room, and there is a doxy system set up where they can sit down and have a face-to-face with a counselor and do a short session. And in those short sessions, a lot can be accomplished in 15 minutes. We've gotten clients to go to group. We've got clients who have never gone to group before. We've gotten them into group therapy in those 15 minutes. We've engaged clients in counseling. Clients have come in and reported their milestones. They've been excited to say, guess what, Kristen, this week I was clean all week. I didn't use this week. Why don't we check my urine drug screen? So those 15 minutes can be really beneficial and, can really give us a chance to connect with the client. And it also gives the client a chance to expand their support system. They never want to put all their eggs in one basket. So it gives the clients a chance to expand their support system and connect with different counselors.
And also, back to community engagement, we've hosted several events to educate the community on MAT. We've had news anchor Fox 2 Amy Andrews that has come and has featured several of our offerings. We've also had Braylon Edwards, U of M football player that would come. He wrote a book, and we had a book signing. We had a very nice turnout with him educating the community about recovery and how it's possible. We've also had an active shooter training, which unfortunately nowadays is pretty necessary. And we invited not only our partners of Oakland County, but also the outside community. The people we serve, like Kristen has emphasized, we call them the doxy rooms, which is something very new, but it's been very effective. And we're on the forefront of doing things that work to help the client. So we're able to use the digital divide. We're able to use telehealth to actually help clients. And some clients prefer it more so than face-to-face. But whatever they need, we're there to serve. So as I close, we just want to, we're very excited about all the things that are occurring within therapeutics. We're open to ideas. We have a team of engineers actually that they're working on a device that will control the amount of medication given to clients, which is not only a safety mechanism, but hopefully to curtail diversion in the community. And with that, I will close and give the floor to someone else.
Thank you very much. I really appreciate the presentation you guys did tonight. Are there any questions or comments from board members? I'll start here in the room in Troy. Melchiah?
thank you, Kristen and Deidre, for a very, very engaging presentation. And I can see why, Kristen, your groups are so well attended because you're very animated. And I want to congratulate you on how much you've been able to accomplish. And it's hard to tell how old you are on the video screen, but you've done a lot in a very short time. And I'm happy to have made your acquaintance today. And I wish you well in all your future endeavors. I'm very impressed with the organization. You are doing some things that I haven't heard anyone else doing, which is another thing that impressed me about your work. So thank you, ladies, for the presentation, and you are definitely shining stars. So thank you for coming and speaking with us tonight.
Thank you.
Thank you.
Anyone else from here in Troy? Okay, are there any hands? John Paul.
Thank you. I appreciate hearing your story. So I was interested to know, I know that you said you went to law school. Are you interested in practicing law at all? And I asked because I think you'd be a tremendous resource as an advocate in the legal arena, especially with so many within the legal system that have substance use issues or have had similar stories to what you had without the, all of the great successes that you've had.
Yes, I would like to practice law. I want to combine my MSW and my law degree and do a lot, on the policy level, on the macro level. But yes, my main goal in going to law school was I really wanted to work with women who had rehabilitated themselves and who had a really hard time navigating the family court system and were unable to regain custody of their kids. And that was my whole reason for going to law school. And I still, have that dream, and I would still like to do that. But right now, I'm really happy with where I'm at right now. So thank you.
Yeah, and that's really fantastic because I'm actually have been seeing more and more over the past few years attorneys that end up getting their MSW as well. So it's kind of like a dual thing, makes you even more, more valuable to help people, having that therapeutic end and then the legal end. So kudos to you and congratulations on all of your hard work and your successes.
Thank you so much. Thank you.
Are there other questions from board members remote? I'm not hearing anything. I have a question for you, Deidre and Kristen. You guys talked about the support that you're providing to Monroe and Washtenaw County jails, and I know that you're providing services to Walled Lake and Pontiac, but I'm not sure those are our county jail, our Oakland County jail. So how do the services for Walled Lake and Pontiac differ from what you're doing for Monroe and Washtenaw?
Well, our clinic is located in Walled Lake, and we are going to be opening another clinic in Pontiac. These are outpatient treatment programs. We also have a clinic in Ann Arbor that has contracts with the Monroe County Jail and the Washtenaw County Jail, for which we service them. We do not service the Oakland County Jail. As I recall, that's being serviced by Sacred Heart at this point.
Okay, thank you. Yeah, I was sort of curious about the services that are in Oakland County that you are providing, to understand how those...
Yeah, we're providing medicated assisted treatment in our location in Walled Lake right now, and we're going to open another location in Pontiac.
All right, thank you. Are there any other questions from anyone? All right, well, I want to take a moment and just say thank you so much for sharing your story, Kristen, and for Deidre, and helping us better understand what therapeutics does in the SUD, which is the substance use disorder space. I use that term before SUD, and I should try to remember to spell out all of these terms. So, again, thank you.
Thank
you.
you.
And you're welcome.
Next on the agenda, we have two proclamations that I'm going to be seeking approval for. One is for suicide prevention. The other one is for recovery month. So I'm going to take a moment and actually read them and then seek a board motion and approval. All right? So I'm going to start with the suicide prevention monthly or suicide prevention month proclamation. September is known as the National Suicide Prevention Month. It's intended to help raise awareness surrounding suicide prevention resources available in the community. And World Suicide Prevention Day is observed each year on September 10th. And suicide thoughts can affect anyone regardless of age, gender, race, orientation, income level, religion, or background. And according to the CDC, each year more than 48,000 people die by suicide. In May 2020, so a year and a quarter ago, during the COVID pandemic, ED visits for suspected suicide attempts began to increase among adolescents aged 12 to 17 years old, especially with young women, with girls. And organizations like NAMI, so the National Alliance on Mental Illness, and the National Suicide Prevention Lifeline, 1-800-273-TALK, or 8255, work to help individuals in crisis and provide resources to shed light on this highly stigmatized topic. And whereas every year thousands of individuals die by suicide, CDC had said it was more than 48,000 last year. So every year thousands die by suicide, leaving friends behind, family members behind to navigate the tragedy of loss. Often feelings of shame and stigma prevent them from talking openly. And whereas Oakland Community Health Network, OCHN, is committed to being a zero suicide organization and cultivate a network of providers who are engaged in the zero suicide philosophy. So now, therefore, be it resolved that OCHN, or Oakland Community Health Network, hereby recognizes September 2021 as the National Suicide Prevention Month. OCHN calls upon our citizens, government agencies, public and private institutions, businesses, and schools to recommit our state to increasing awareness and understanding of suicide prevention and the need for appropriate and accessible services to assist individuals in crisis. Okay. I'd love it if we had a motion to approve this proclamation.
This is Sarah. I'll make a motion.
All right, we have a move by Sarah. Is there a second?
This is John Paul. I'll second it.
All right, thank you. So we have motions by Sarah, seconds by John Paul, and by Dr. Taub. Is there any discussion on this proclamation? All right. In that case, I'm going to do what all those in favor of. I don't think we need a roll call vote for it. So all those in favor of approving this National Suicide Prevention Month proclamation, say aye.
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 Thank you. Is there anyone that would vote against this? Please say no. Hearing none, this proclamation passes. I am so glad. I am a fan of trying to stop suicide. And I'm going to put my John Paul Torres on here. Thank you. All right. September being a busy month, and we don't have enough months in the year for everything we cover. The second proclamation is regarding National Recovery Month, and that's also for September. So this proclamation, I'll start it off with, whereas according to the CDC, Center for Disease and Control and Prevention, individuals with substance use are at greater risk of contracting COVID-19, and more than 81,000 overdose deaths occurred in the United States during the 12 months prior to May 2020. That was the highest number of overdose deaths ever recorded in a 12-month period. And according to SAMHSA, so that's the Substance Abuse and Mental Health Services Administration, in 2019, 9.5 million people, that's 9.5 million people, 18 years or older, had both substance use disorder and a mental illness. And whereas substance use recovery is important for individual well-being and vitality, as well as for families, friends, community, and businesses, and whereas we will continue to educate and raise awareness of the risks and potential harm associated with prescription drug misuse. Stigma, stereotypes associated with substance use disorders often keep people from seeking treatment that could improve their quality of life. And whereas substance use disorders occur when the recurrent use of alcohol and other drugs causes clinically or functionally significant impairment, such as health problems, disability, and failure to meet major responsibilities at work, school, or at home. And whereas substance use disorder recovery is a journey of healing and transformation, enabling people to live in a community of their choice while striving to achieve his or her full potential. And whereas substance use disorder recovery benefits individuals with substance use disorders by focusing on their abilities to live, work, learn, and fully participate and contribute to our society. And it also enriches the culture of our community. And now, therefore, let it be resolved that OCHN, Oakland Community Health Network, hereby recognizes September 2021 as National Recovery Month. OCHN calls upon our citizens, government agencies, public and private institutions, businesses, schools, to recommit our state to increasing awareness and understanding of substance use and the need for appropriate and accessible services to promote recovery. So that's our proclamation. I'm looking for a motion to approve this proclamation.
I'd make that motion to approve the proclamation for Substance Use Recovery Month, September 2021.
Thank you very much, Melchiah, Ms. Newman.
And
Is there a second?
And I second that. It's Adam.
Thank you, Adam. So there's been a motion by Ms. Newman, a second by Mr. Furman. Is there any discussion? Hearing none. All those in favor of this proclamation for National Recovery Month, September 2020, please say aye.
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 Okay, thank you. I'm not even going to ask for no's. I appreciate it. And again, I'm going to sign this.
Hey, Jonathan, I have a question. This is John Paul.
Yes, sir. Yes, John.
Just more of a statement. Well, I guess a question. The proclamations, do we send those? I want to say actually too that I appreciate that we read them out because it's easy to just pass them without reading them. So it's nice that we do read them out so everybody can hear the language in them. But do we pass these along to any other organizations or maybe like Oakland County to see if they're interested in doing a resolution or recognition of National Suicide Prevention Month or for the National Recovery Month?
We actually send them to all of the councils and cities and townships throughout Oakland County, and I believe last year you had suggested we send them to school boards, so we do that as well. And the Board of Commissioners receive a copy with a request for them to read the proclamations in their own communities. They frequently will send us signed proclamations so that to verify or they notify us via email.
Oh, okay, that's excellent. Thank you.
Okay. Were there any other comments on these two proclamations? Okay. If not, I'm going to move on to the next item on the agenda, which are reports. The first one is the Board Executive Report. The executive committee met hybrid on July, I don't have the right date, for our standard first Wednesday of the month. I think it was July, couldn't have been July 4th. It was attended by Vice.
4th.
It was August. Well, that makes sense. I didn't change the word August. Okay, August 4th. For our standard first Wednesday of the month noon meeting. It was attended by Vice Chair and Chair of Policy Committee, Dr. Sarah Guadalupe, Secretary Adam Furman, Chair of the Business Operations Committee, Eric Lindemeyer. Also attending was our board member, Ms. Melkina Newman, as well as our CEO, Dana Lazenby, our CLO, or Chief Legal Officer, Kalana Ali, and our Administrative Assistant, Sheila Barrett. We met, discussed, and set agendas for the August Committee of the Whole meeting, the regular or general board meeting, and for the study session. We also talked about stories that inspire and about the current COVID-19 and COVID vaccine situation. We also discussed our lobbyist efforts to set up meetings with Dana, our CEO, with various members of the State House and Senate. And Dana discussed her experiences at the Medicaid Health Plan Conference. There was also discussion about what board members can do and the public do, our advocating efforts, defending our public option. And these three items will be on the Committee of the Whole. The budget amendment for discussion, the budget amendment number 3, but also we'll take action at this August board meeting. With more people now being out in public, it seems to make sense to bring back our anti-stigma series, BEST, which is not beat stigma today, but it's begin ending stigma today, as perhaps one of our recurring general board meeting topics. That was something I brought up. With this being August, we will have proclamations as well. There will be a study session. This month, that will be on Thursday, the 26th. The topic will be OCHN's fiscal 2022 budget. We will require board approval of that budget at the September general board meeting. So that's what I have to report at the board chair meeting. Thank you. Are there any questions? All right. Next on the agenda would be the Policy Management Committee Chair report by Dr. Guadalupe.
Thank you, Mr. Landsman. During our Committee of the Whole meeting, in terms of our policy management section, we were provided with a quarterly update by our quality management team, Marquita Massey and Wendy Schiller. A status report was provided on the following goal areas. 1, audit and accreditation. HEDIS performance rates were provided. Number 2 was the MDHHS contract compliance. And 3 was home and community-based services update. That included performance bonus incentive and performance indicator updates. These protect and promote quality service delivery. All individuals served, the provider community, and the community at large benefit from the attainment of the goal area in the OCHN annual and strategic plan. This is because the annual plan was developed based on feedback obtained through OCHN needs assessment, where persons served and other stakeholders were asked to provide input on desired focus areas for improvement and opportunities for OCHN. Our performance quarter ending for March 31st, 2021 was submitted June 30th, 2021. OCHN met the established standard for all indicators. Indicator 1 being timeliness of inpatient screening, quality improvement efforts made by Common Ground. There was no standard for indicator 2 and 3. The standards were removed to establish baselines. And a new indicator, indicator 2E, expired requests are approved requests at a SUD provider that do not result in a BH-TEDS admission within 60 days of the request date. Marquita, if you're on, could you remind us what TEDS, I'm sorry, I'm looking through the notes and I have the acronym TEDS, but I don't recall what that was. Well, I guess we can come back to that. Just trying to get that acronym so that folks know. Thank you.
That's the end of your report?
That is the end of my report, and if somehow we could get the acronym, I'm sure that would be helpful if we can put it in the chat, because I do not recall what that stood for.
I can do, it's behavioral health treatment episode data set.
Thank you, Sheila.
I was going to say it.
And that's one reason why they make them acronyms, because those are hard to remember. All right, thank you. Next item on the agenda is the Business Operations Committee Chair Report. Mr. Lindemeyer.
Hi, thank you, Jonathan. I actually have two things to report. I'm not sure how we want to handle them. So I have my normal Business Operations Committee report, and then I know after that we've got the budget amendment. But for the Operations Committee report, we met during the Committee of the Whole meeting on August 17th. Anya, our CFO, presented the June 2021 financial trends, and as we do every month, we have a comparison. We not only look at the trends, but we compare our financials to the previous year. So I'm going to talk about the trends and the comparisons. When we think about the trends, there are four things that we need to look at. One is that our revenue is still showing an increase from the previous year. As expected, revenues are leveling out as things continue to stabilize. Number two, the eligibility trend is showing an increase from the previous year and is still consistent with previous months. Number three, when it comes to our assets, our cash and investments are up and our receivables are down. Capital assets are down due to depreciation. And then number four, our liabilities are down. Our vendor and employee payables are down, and our long-term payables continue to decrease as payments are made. When we go into look at comparisons from the previous year, when we look at our revenue, Medicaid is up, and the general and county funds still remain the same. Number two, our net income is up significantly from the previous year. Number three, our expenses, we show no major increases, and our provider network is showing an increase just due to the direct support professional wage increase. I think that's been going on for like a year now. And then finally, our net position. So our total assets are showing an increase and liabilities are down, and that is resulting in a positive net position. And that's my report.
Thank you, Eric.
So then I know that I also have the budget amendment. Should I go right into that?
Let's do that, please.
Okay, well, so Anya, again, at the Committee of the Whole meeting on August 17th, Anya had presented regarding the information on the budget amendment. And Anya had provided the board with an overview of budget amendment number 3. She highlighted and detailed information to our increases in revenue and expenses. The budget amendment displayed an increases such as the following: a total increase in revenue of $4,846,349 and a total increase in expenses of $2,949,135. This results in a net change from revenue to expenses to equate to $1,897,214 of an increase in the budget. And this is, there is a board approval required here by roll call vote.
Okay. So with that in mind, I'm looking for a motion to approve budget amendment number 3.
I so move.
Steve, Dr. Taub has made that motion. Is there a second? Dr. Hans has made that second. Is there any discussion on this motion to approve budget amendment number 3? Hearing none, let's do a roll call vote.
Dr. Hans,
Yes.
sorry. Mr. Torres,
Yes.
Mr. Furman,
Yes.
Miss Newman,
Yes.
Miss Root, Miss Namie Dyer,
Hopefully you can hear me now. Yes.
Dr. Guadalupe,
Yes.
Mr. Lindemere,
Yes.
Mr. Cowan,
Yes.
Dr. Taub,
Yes.
Mr. Landsman.
Yes. Sounds like the motion carries for budget amendment number 3's approval. Thank you. Next on the agenda is the consent agenda, and this is approvals for the prior meeting minutes from last month's board meeting, along with acceptance of meeting minute reports for recipient rights, committee of the whole, citizens advisory, and substance use oversight. So I'm looking for a motion to approve the consent agenda.
So move. This is Steve.
Thank you. Is there a second for approving the consent agenda?
Support, Newman.
Thank you, Ms. Newman. So we have a motion by Dr. Taub, a second by Ms. Newman for the consent agenda. There is no discussion on consent agenda, so we'll do a roll call.
Dr. Hans,
Yes.
Mr. Torres,
Yes.
Mr. Furman,
Yes.
Miss Newman,
Yes.
Miss Root, Miss Namie Dyer,
Yes.
Dr. Guadalupe,
Yes.
Mr. Lindemere,
Yes.
Mr. Cowan,
Yes.
Miss Bernard, Dr. Taub,
Yes.
Mr. Landsman.
Yes. So the motion carries for our consent agenda. Thank you. Next item on the list is other business, and as part of other business, we have a COVID-19 update by Dr. Posio. Good evening, Doctor. I finally get to say hello to you in person.
Yes, it's my first time meeting most of you in person. It's good to meet you all. And thank you for inviting me to present tonight. Next slide. So I would like to discuss the current state of COVID-19 in Oakland County and in OCHN among our population. So the problem obviously is COVID-19 and the Delta variant. Why should we be concerned? Well, the population that we serve is at particular risk of severe illness and death from COVID-19. So it is a concern that we have to take seriously. Solutions, what are we doing and have done to solve this problem? And next steps, what are our goals and future plans with regard to tackling COVID-19? Next slide. So as you've probably all heard by now, the Delta variant is the dominant form of SARS-CoV-2, the virus that causes COVID-19. And you've probably heard experts describe it as being COVID on steroids. And the reason why that is because it's much, much more contagious than any previous form of COVID-19. As you can see on the right-hand side of this slide, there's a infographic that demonstrates that the Delta variant, one person infected with the Delta variant can go on average to infect 5 to 8 additional people with SARS-CoV-2. Now that compares to, on average, 2 to 3 people with the original virus, the so-called Wuhan variant, and 4 to 5 people with the Alpha variant, or what was also referred to as the UK variant. So it's infecting more people. That means it spreads more quickly. And why is it infecting more people? Why is it more contagious? Because it causes the amount of virus that reproduces in your body to be much higher than previous versions of the virus. Some estimate it to be 1,000 times higher than the original Wuhan variant. And also, pretty alarmingly, some studies suggest it takes as little as 5 seconds of exposure to this variant of the virus to become infected. Next slide. So we're in a situation now where vaccine effectiveness in terms of preventing symptomatic infection seems to be slightly reduced. Now there's different estimates on how reduced it is. There's data from Israel, data from UK, Scotland, and Canada that are kind of all over the map. But the bottom line is that we know that it is possible to become symptomatic if you're vaccinated, and even if you're symptomatic or asymptomatic, if you're infected while vaccinated, because this version of the virus reproduces so much more than the other versions, it means that you might be able to pass it on to other people. The CDC, therefore, made a recent recommendation that despite your vaccination status, if you're indoors in public, you should mask. And we here at OCHN internally are following that CDC recommendation, which is hinged upon the CDC's estimation of viral transmission, which I'll get to later. The good news, all of the current vaccines that are approved through the FDA's emergency use authorization remain highly effective at preventing hospitalization and death from COVID-19. Also something that we'll explore a little bit more in a later slide. Next slide, please. So this is the COVID-19 dashboard that the Oakland County Health Division has on the oakgov.com website. And so you can see this is a tally of the total cases of COVID-19 in Oakland County to date, almost 106,000 cases. You'll see on the right, if you actually go to the website and play around with this, you'll see that over the course of the past week, there have been about 3 deaths from COVID-19. Now, at the height of previous waves, we were seeing dozens of deaths per day. So this is a dramatic improvement in daily deaths. Next slide. I want to focus in on the 7-day average of daily cases. And you can see that Oakland County and Michigan in general have had basically 3 waves so far, and we are now at the start of what appears to be a 4th wave. Modeling suggests that this current wave may peak at the end of September, fall a bit and then kind of plateau going into November. But where it stands right now, Oakland County is at about around 16 to 17 cases per 100,000 people per day. Obviously far lower than the two previous waves, but still more than most people had hoped for at this point. Next slide. So in terms of hospitalizations, we're seeing in Oakland County about between 100 and 150 people in the hospital because of COVID at any given time right now. This is up by about 33% over the course of the past week. So the hospitalizations are going up. However, again, the hospitalizations are thankfully much lower than they had been during the previous waves, and this is no doubt due to the relatively high level of vaccination in Oakland County. Next slide. Again, just touching on daily deaths from COVID-19 in Oakland County, we're averaging right now about 3 every week or so, which, as you can see, is nowhere near the massive amount of deaths that we experienced, especially during the first wave. Next slide. So again, this is as of the 16th. Oakland County had 15.5 cases per 100,000. The infection rate, 1.19, which has been varying, but the higher the number, the higher the rate of infection in the area. About 6.5% of tests are positive for coronavirus. You start to worry at rates above 5%. And vaccinated, but we'll dive into that a little bit later in more detail. The most important thing on this slide, I think, that I want you to recognize is that according to the CDC, the rate of transmission of COVID-19 in Oakland County has now reached the high stage. Anything that is substantial or high, they recommend people, regardless of vaccination status, wear a mask while indoors in public. Next slide. And here's our updated masking policy in case you'd like to take a look at it. Next slide. Next slide. So again, why should we be concerned? Well, because the people that we serve, people with serious mental illness and substance use disorders, have increased risk of severe illness, hospitalization, and death from COVID-19. So there's SMI and SUD are listed as risk factors for severe illness on the CDC website. And there's also a couple of studies that came out this year I thought were interesting, both from JAMA Psychiatry. Patients with schizophrenia have more than twice the risk of death related to COVID-19, and mental health disorders tied to increased risk of COVID-19 related mortality. So we have to be concerned about this. Integrated care is one of our missions at OCHN, and we really need to make sure that our population is as protected as possible from COVID-19. Next slide. So this is a slide that shows a little bit of a summary of how COVID-19 has affected the OCHN population. As you can see, we've had a total of 734 COVID-19 positive cases in our network, and we've had, unfortunately, a total of 36 deaths from COVID-19. Next slide. With regard to vaccination status in Oakland County, Oakland County has reached a stage where they've gone above 70% of people over the age of 16 who are vaccinated. The percentage of those who are fully vaccinated, so have had 2 shots, is 64%. And with regard to ages 12 and up, 69% with the first dose. So some progress is being made with the 12 and up group as well. I'm sorry, next slide. So this is a little bit hard to read at a distance, but I encourage you to take a look at your slides in front of you. And there's a breakdown on the percentages of people who, percentage of people in our network who are fully vaccinated and have had a first dose. And I am going to bring that up on my laptop because I did not anticipate having such a small screen in front of me here. So if you give me one moment.
I don't have your slides in the packet that was on the Teams site.
Okay, if you don't have the slides, I'll make sure that you get them.
Okay, thank you,
Yeah.
Dr. Posey.
Sheila, if you could make sure the slide deck is available on Boardable for the board members.
The whole presentation's on the front page of the meeting.
If you could send a note out to the Boardable to the board members to let them know where they'll find it, that would be really great. Okay?
Okay.
Thanks.
Yep.
Okay, since we have a lull, is there more than one place on Boardable where the packets are? Because this is the packet that was associated with the invite, and his slides aren't in there. So is there somewhere
I can
else?
just, yep, if you just go to where the meeting link is, you'll see a link that says board presentation, because that's where we can provide the links. So you'll have a,
Okay, sorry about that. But we'll make sure that we get the slides out if you don't have them. So the numbers that I want to point you to on the upper left-hand side of the slide, 35.7% of those eligible to receive a vaccine in our network are now fully vaccinated. This compares to somewhere in the neighborhood of about 50% across the state of Michigan as a whole. And not with regard to people receiving mental health treatment, but rather the general population. The persons with intellectual developmental disabilities, 57.42% of those eligible are fully vaccinated. Adults with mental illness, 35.97% of those eligible fully vaccinated. Children with serious emotional disturbances, 24.68% fully vaccinated. And persons receiving SUD services, 19.77%. So by and large, the group that is least vaccinated among those we serve, but in general, all of the people that we serve who are eligible to be vaccinated, the numbers do lag a bit behind the state and county averages. There's further breakdowns in terms of demographics and also according to our provider network as well. So I encourage you to take a look at these data, but given the amount of time I have, and I do want to be able to answer questions, I'll go ahead and move to the next slide. So breakthrough cases, we hear a lot about breakthrough cases. Our data isn't perfect because now people are getting tested in less formalized ways, and that data is not as centralized as it once was. But for what we can track, we've only seen 9 cases in which somebody has tested positive after being more than 2 weeks out from a second dose of vaccine. So this is good news. Next slide. So again, as I mentioned earlier, forecast, the numbers are going to go up, possibly peak end of September, and then kind of settle into a plateau going into the winter, which is not necessarily good news. Next slide. So in terms of things that OCHN has engaged in to try to get our population vaccinated, we have the communications team headed by Christine Burke has done a fantastic job in terms of getting the message out, getting people vaccinated in this building through partnerships with Honor Clinics and Genoa Pharmacy. Again, in the interest of time, I'll allow you to read the details here, but I do want to talk a little bit about the numbers in terms of who we vaccinated. So next slide, please. In addition to the efforts so far, Christine's team has outlined some efforts with regard to advertising, education, getting the message out, encouraging people to get vaccinated, and also using some grant money available through the department to fund a 2-year vaccine education campaign that includes cable, print, social media, billboard, radio education awareness. And OCHN, in partnership with OCHD, will be providing vaccinations at the OCHN Recovery Celebration. Next slide. So the vaccine clinics that OCHN has hosted in partnership with Honor and Genoa, we've given a grand total of 2,109 first doses and 1,903 second doses. Next slide. And Genoa has also partnered with us in terms of, as I stated previously, giving vaccines both in stationary clinics at their Waterford facility and also in facilities co-located with some of our partners. They've given 2,000 doses of Moderna to people in Oakland County and 2,000 doses of Moderna to people in Oakland County and Macomb County. Next slide. General Waterford administered a total of more than 1,000 doses. First and second dose clinics were held at OCHN here and as well as at Common Ground. Next slide, please. And more recently, Genoa offered to provide mobile vaccine services to our SUD community partners. And so they've given vaccines at Meridian, 141 total doses, Sacred Heart, 40 doses, Turning Point, and Eastwood Recovery Center, which they just started doing last week. So slowly but surely, we're trying to make a dent in that population. Again, the folks with SUD diagnoses, the least vaccinated in our population. Next slide. Next slide. So where do we go from here? So I'm in close consult with the Medical Directors Advisory Group, strategizing about how to get our population vaccinated. As I stated previously, we do have some work to go. We have a monthly vaccine-specific meeting that's growing in size every month. We are exploring the possibility of getting some local celebrities to participate in a television ad campaign to get the word out about vaccinations. As I previously mentioned, the education campaign from MDHHS, and then also trying to maximize our reach into the community using the mobile vaccine clinics. Really working with OCHD, Honor, and Genoa to reach, for example, the faith-based community, but also meeting people where they are at in terms of going about their daily lives. One of the possibilities is to reach people where they do their grocery shopping. So in some of our areas in Oakland County that are designated food deserts, people are shopping at gas stations and dollar stores and that sort of thing. And there's a little bit of an overlap with the targeted demographic that we're looking for and those situations. So trying to get mobile clinics to those areas to vaccinate as many people as possible. And also, like with our recovery celebration, making sure that we're offering vaccines at community events that we're sponsoring. And then also on the horizon, with the Biden administration recently announcing a plan for offering booster vaccinations, looking at booster clinics in the fall. Next slide. And with that, I'm happy to take questions. And again, if anyone does not have a copy of the presentation, I'm happy to share it.
Dr. Hans.
Thank you for your presentation. This is very helpful and very encouraging, the work that we are doing. My question is about the SCD children. The vaccinated are the ones that are eligible for vaccination. I would assume it's the children over the age of 12.
That's correct.
Okay. My second question is about the deaths. Any idea what age group those deaths were in from COVID-19?
Within our population specifically?
Our system, yes.
I do believe that's broken down in the graphic that I have in the PowerPoint, but if it isn't, I can get that information for you.
Thank you.
Yes.
All right. Other questions? Ms. Newman.
Yes, Dr. Pazio, Sheila was able to direct me to where it was, so I do have it. I apologize. But the question I have is, did they say, give any reasons why our populations were at such great risk for COVID?
Yeah, so there are some, I think there are some explanations that go along with kind of inherent characteristics associated with lifestyle, with people diagnosed with SUD and SMI, but also with regard to treatment. So a lot of our treatments, unfortunately, can have unintended consequences such as weight gain and increasing blood sugar, diabetes, that sort of thing. And that certainly doesn't help in terms of risk stratification. But there's also other explanations that we haven't really understood well, but more closely tied into disparities in healthcare that explain, hypertension, poor diet, that sort of thing. So it's kind of complicated, but it is a mix of healthcare disparities and effects of the treatment that we provide.
Dr. Guadalupe.
Yeah, I just had a quick question on the booster shots, and I know that there's probably still a lot of information forthcoming with that, but have you heard anything like if someone got a Moderna that it would be a Moderna-specific booster or Pfizer-specific booster, or is it just a booster in general?
That's my understanding. So currently, people who are immunosuppressed, people who have had organ transplants, HIV, other conditions that may cause them to be immunosuppressed, medications they take and so forth, they're currently able to receive a third dose. They're not calling it a booster, but a third dose of vaccine, and that is recommended to be the same brand as the one that they originally received. It appears as though the announcement hasn't been made yet, it appears as though that same recommendation is going to be made for folks that are not considered immunocompromised, but are more than 8 months out from their second dose of vaccine. So if you got 2 shots of Pfizer the first time, the third shot will be Pfizer.
Thank you.
Dr. Toss.
Yep.
Yeah, another of the comorbidities of the people we serve is smoking. Cigarettes
Yes,
really increases the risk.
absolutely. Thank you for that.
Is there any other board members, either virtual or local, that have a question? I have a couple of questions for you,
Sure.
Dr. Posio. So as I understand it, this variant D is, I'm not sure how I could qualify it, but bigger and faster, that the incubation period is, I've heard, is 3 to 5 days versus the 7 to 10. So you'll know it if you're sicker sooner, if you've not been vaccinated. All right. So you mentioned that all of our populations, so the developmentally disabled, mental illness, SED, as well as substance use, are all well below state and county numbers. So what kinds of specialized messages, and maybe this is for Christine Burke rather than you, but what kind of specialized messages are we directing towards each of those populations? Because they're very different. Their personas are very different as to why they've chosen or not chosen to take the vaccines.
Yeah. I'd like to take a stab at that first,
Okay.
and I'll pass it off to Christine, if that's okay. So the first, I want to make clear that the discrepancies or the lag between the percentages that our population is vaccinated versus the general population, that's a lag that we're seeing across the board, regardless of whether we're in Michigan or another state. So it's not specific to Michigan or Oakland County per se, although I think that we are doing a lot better than other counties in this state, certainly in terms of getting our population vaccinated. But there's a lot made about what can we do to target specific groups, and I'll let Christine speak to that in terms of messaging. But there's some studies suggest that the most important thing is to just remove barriers for people and just make it as easy to get as possible. That's the biggest deciding factor. There was one study where people, they said that the most important factor was getting a ride to get a vaccine, even over money. And so that's why, really pressing the pedal to the metal in terms of the mobile vaccine clinics and getting it available out in the community, that's something that I think we really, need to hyper-focus on before the winter time to make sure that we get much more of our population vaccinated. Christine?
Is it okay if I stay here? Did you want me? That's fine. So a lot of the messaging that we develop is modeled after messaging in a toolkit that the CDC created, as well as the department. And so to your point, there's different messaging, different concerns regarding the vaccine. Some is race or ethnicity related. We did do a study with our substance use disorder population in terms of asking why they were not getting vaccinated, and then what type of messaging we should create. So that is what we will be using moving forward. We just did that survey recently. Some other things that were of concern were especially with the environment in which vaccinations are given. So we created flyers and posters, information that we distributed to if you are giving a vaccination to an individual with sensory challenges, that we wanted to be sensitive to that. Some people are afraid of needles. So there is an array of reasons, and the CDC has done a nice job in addressing those. I will say that I believe early on, those who really wanted to be vaccinated were coming forward. And to Dr. Posio's point, we're at a stage now where it is addressing those barriers, which it may be transportation, it may be isolation. Some are just will say they're waiting to see, and they're watching what's going on with their peers.
So between the two of you then, and I think that's great that we're going ahead to understand our populations better, to know what's the right kind of messaging. because we're closer to them and we know what may be acceptable. Do we think that the numbers may go up once there's formal approval versus emergency approval of these vaccines?
Yeah, we'll see a bump. I mean, it's not going to solve the problem, but we'll see a little bit of a bump for sure.
Thank you. Are there any, Melchiah, Ms. Newman?
When it comes to ethnic groups, I still think that having spokespersons, people that people trust. I talk with family members who have COVID right now and are still discussing, should I have the vaccine? Is it the mark of the beast? It may sound funny to some of those in this room or some listening on Teams, but it's a real concern with some people. And having a person that you trust and have confidence in, a flyer is not a friend. It's not a pastor. It's not a priest. We need to get people involved in the discussion, talking to people that people trust, because that's the only way I had the courage to take the vaccine in February, when I wouldn't even tell my family I had it, because there was so much controversy in our community about taking the vaccine. I know we're doing the best that we can and trying to do all that we can, but we have allies in the faith-based community. I know that they in Detroit, they partnered up with churches, and I know that there's some churches in Pontiac that are doing clinics. My church has done several clinics, and that helped a lot because the church opened its doors and the people felt more comfortable coming to their place of worship to get their shots. So I just say, it's still a lot of fear. People are still afraid. It was so much confusion with the rollout and so much misinformation. So having a face and a person that's trustworthy to bear the message, I think would make a bigger impact.
I agree with you 1,000% in terms of getting people that folks in the community trust to hear that, that it's not only okay, but, that you need to get vaccinated. I think the department has done a good job in television ads featuring, people from the faith-based community speaking, to that message. And again, that's the intention. Let's try to, get out to places where people are interacting with others on a daily basis. So when you go to the corner store and you see, the guy, at the cash register every day, there is some kind of currency there that relationship has. Barbers is another one that would be great, to reach out to. So I agree with you 100% or more.
I just want to share too, Melchiah, I know with the health division, and we turn to them a lot, they are public health educators, but I know they're in the process of bringing together groups, pastors, and other members of the community to look at this from a broader perspective and see what else can they do moving forward. So all of those plans, and out of respect for what you're saying, because they agree, and I agree with you, that those points have been heard, and that the health division is trying to pull together its partners and to move forward as well. It's important.
Thank you. And one other thing, too, is so much confusion. I went to Myers in Waterford on Saturday, and I was terrified. Even people that worked there were walking around with no mask. Masks, it's huge. Then I go to Bloomfield, Aldi's, and just about everybody has a mask. I don't know what we have to do to get the message across to people that this variant is very contagious, and the numbers are starting to go up. I know people are tired. I'm tired. We're all tired. But this isn't the time to throw in the towel. We need to do what we need to do to get past it. But I was shocked at the number of people that were just walking around with no mask.
Mm-hmm.
All right. Any other questions or comments? Not seeing any locally, not seeing anything virtually. All right, Dr. Posio, thank you for bringing us this latest update, the news, as well as the messaging, and Christina Burke, thank you for that as well.
Thank you.
While you're getting ready to present on the next topic, which is our annual draft plan, I just want to take a moment and thank Christine Burke and her team for writing these proclamations. They do a great job. They've done this for years now. And the proclamations are actually, I think they're actually getting better and more to the point. So thank you. I misread the agenda. You were going to read it. I didn't realize that, and I read it. But thank you. All right, next item on the other business is our annual plan draft. And Christine, you're up.
I appreciate you reading that, so thank you. I have been asked to just give you a progress update on the needs assessment and the annual plan so that you have a timeline in mind. As you know, we began the needs assessment in May. Since then, as of today, we have 600 responses. So to put that in some perspective, the greatest number of responses we've ever had was 700. And those are during times when we are face-to-face with people, and we're doing surveys during conferences where we may have 200 or 300 people present. We had 404 responses last year. We did 2 mass mailings to over 5,000 people, one in May, one in July. We also continue to promote the needs assessment on social media. We have met with Pastor Jones, and we've shared it with the Greater Pontiac Community Coalition. Oakland County also put our survey out on their listserv. I contacted El Centro La Familia and asked if they would please share the survey within that community. We mailed hard copies of the surveys to 300 survey sites, and we have received over 100 surveys back from those residents. Usually we include a stack for person served, a stack for provider, direct support professionals as well. We did in-person presentations to 4 clubhouses, 1 drop-in center, 2 substance use disorder treatment centers. We also did presentations to all of our OCHN work group members. And just that format's a little different. We do ask people to complete the survey, but that's more of a dialogue where we sit down and we have a conversation, and it's really an opportunity to hear how they communicate with one another about the topic, and you can, those issues that resonate, you can identify more quickly. One thing that I am very excited about this particular survey is over the years we have tried to increase the response of people receiving services. So early on, we saw that they were often the least in terms of number of surveys returned. This particular survey, we have received the most from direct support professionals, but the second from people receiving services. And we still are pushing this survey out and getting responses. If the board has not, we'd really like to encourage you to complete the survey. The information from the survey has been reviewed by our staff. And so obviously the goal is to have those priorities of the individuals we serve align with the priorities that we've identified as an agency in terms of access to service, enhanced access to services for families and children, crisis service enhancement, and of course always addressing the direct support professional crisis. And we are seeing an alignment there, which also aligns with the department. So it's nice to know that there is a synergy. We are all on the same page. Our staff has completed the initial draft of the plan based on the input of the needs assessment. And now our chief level staff are going to be reviewing the annual plan to make sure that the language, make sure the priorities have been met that are in alignment with the direction that the board has given us, the direction we're receiving from people we support, and also the direction from the state. We will be posting the very first draft on our website this week. Prior to that happening, or maybe simultaneously, very closely, this board will also have access to that plan via Boardable. Any input you offer, those of you who have served on the board for a few years now know that we make adjustments to the plan right up until the time it is approved. It will be presented in its entirety during the September COW meeting, and then hopefully passed during the September board meeting.
Any questions from the board? Here, how about virtually? All right, so to reinforce what Christine just said, yes, we have a board study session next week on the 26th. It is to go through this, the annual budget plan, but as well, if you go to the website, there's also a Tuesday, August 24th, for the public presentation on the annual plan and budget. And as well, I believe that the fiscal budget the draft will be available on Thursday, August 19th, which is later this week, 2 days from now.
Yeah, so the draft of the budget will follow. We sometimes leave that as to be determined, depending on how Budget and Finance has to align their numbers with information from the state. So the plan you will see on the 19th or the 20th will be the written portion, but I know Anya will have her piece ready for this board during the study session. I think that is the plan.
Yeah. So lots of opportunity to study it, ask questions, provide input, and help, because we are a board of directors, to provide some direction to where the organization goes based on that. All right, thank you so much.
You're welcome. Have a great night.
Will do. Next on the agenda are board reports. We have from Recipient Rights Advisory Committee, John Paul. John Paul, you may be on mute.
Yeah, sorry about that. I'm on mute. So the Recipients' Rights Advisory Committee, I actually attended it towards the end of the meeting, and we were having some technical difficulties. So I'm just going to basically give an overview of what the agenda was with regard to it, and then the minutes will be available for our next board meeting that you could review if you're more interested. But we got the director's update from Vicki Suter, the rights manager update as well, reviewed semi-annual fiscal year 21 rights reports, then discussed the fiscal year 21 goal number 2, which is obtaining education on guardianships in support of decision making and determining ways to have positive influences. And I think that's something that many people on our committee are very interested in partaking more in, helping individuals with their guardianships and supporting them in the process, because they can often be very, very difficult, and there's a lot of, a lot of issues involved, as we've even seen most recently with all of the things happening in the entertainment industry with the guardianship that's happening with one of our entertainers. Policy review was discussed by Vicki Suter, the exchanging of confidential information. We received another site visit report, and the next items on the agenda for our next meeting will be discussed the Dan Moran Rights Advocacy Nominations Form and how to improve it. More information on site visit reports as they continue on, and review of the Rights Office budget. Again, though, I wasn't able to give detailed information because I got to the meeting at the second half, but I did want to provide at least something. And we were having a number of technical difficulties, as we do in this day and age, during that meeting. So that's my report. Thank you.
Thank you, Mr. Torres. Ms. Newman, do you have a report on Citizens Advisory Committee?
I'm sorry, I do not.
Okay, and I don't believe Substance Use, the Oversight Policy Board met. Is that correct, Mr. Lindemeyer?
No, I have a report.
Oh, you do? Okay.
Thank you. I do want to remind everyone, I believe that we do have the minutes to the meeting that we approved, I think, in tonight's meeting. So I'm going to go over some highlights, and if there's, after reading the minutes, if there are questions at the next board meeting, I can answer them. But so I had, the first item on the agenda, I had given an update on the bill to privatize, what I call privatize the Medicaid services and totally change, the public mental health system in the state of Michigan. There was a recommendation, I had made a recommendation that we send out the talking points to all of the committee members, and that the committee members contact their legislators to tell them to vote against the bills that Senator Shirkey and the bills that they have introduced in the House. And I believe that that email was sent out to everyone on the committee. So we did discuss that in the committee. The second thing is we went through a review of the committee's bylaws, and so there was a motion to approve some changes to the bylaws. And our chief legal officer, Kalana, was involved with that process of reviewing the bylaws. I think the most significant thing is that there were, we did fill 3 out of 4 positions that were available on the board. We kind of revamped our appointment process, and so the committee approved three people to join the committee. The first one, her name is Colleen Crossy. The second one, her name is Tanisha Moir. And the third one, many of us know, is Shelley Top. And so it's great to have Shelley on the committee. We did receive some treatment updates, and I know that there was somebody had asked a question a little bit about the MAP program in the Oakland County Jail, and so we did get an update on that. The program's now back up and running, and there are 13 individuals that are currently enrolled in the Oakland County Jail MAP program. We did talk about the vaccine update and what was going on with vaccines with the SUD community, and then there are additional updates that we received on prevention and access, and I would just encourage anyone that's interested to read through the minutes to the meeting. With that, that concludes my report. Thank you.
Thank you, Mr. Lindenmeyer. Next on the agenda is the director's report. Dana Lazenby, our CEO, is remote or virtual tonight, but you have the floor, Dana.
Thank you. Good evening, everyone. I hope you can hear me okay. I'm scared to turn my camera on because it was a little difficult connecting, but I will go through my report very quickly, and please feel free to read through it and actually ask me any questions that you may have in this meeting or after. One of the things that I really wanted to focus on in the report as I completed my first year and getting excited for the next year is really to talk about education and awareness of OCHN and how we serve the community. So I was really excited to hear Dr. Pozio's presentation on COVID and all the efforts of our entire team and what we're trying to do to support the community as we continue to battle with this pandemic. And it's been devastating for all of us, but continue to be positive about going in the right direction and really what are the supports that we continue to provide. And so as Mr. Lindemeyer mentioned, we are still in this huge fight as it relates to maintaining and supporting the public mental health system. And so part of what I'm talking to my team about is really demonstrating our importance and our accountability, but also focusing really on persons served. So I had an opportunity to meet with several of the board members, and I want to continue to do that ongoing, but really focusing back on persons served and always putting them first. I know we talk a lot about budgets and the things that we do, and those things are extremely important to maintaining the service network, but I also want to really talk about and focus on our outcomes and how our priorities align with what the state's priorities are, but also because they're the right thing to do for people we serve. So just to go through the strategies and the priorities that we have, and I'm hoping you're starting to see a theme with me. Not that I'm repetitive, but really I want to keep us focused on those priorities because they really demonstrate the outcomes for people. And so we can't ask advocates and families and other people to support the public system if we're not accountable and we're not delivering for people we're responsible for serving. So again, importance of enhancing, expanding our access to non-emergent and crisis services. So I heard something interesting today while I'm here at the CIT. It's not a crisis service. We really want to make sure we have a system that doesn't have breaks, but is a continuum of care for people, so that the only option is not to show up in the ED or just a crisis center, but really how do we enhance our services so that people know where to go and when to go. So you'll see a theme there. The other thing is integrated behavioral health care. And I think Dr. Pozio's report is a prime example of why that's so critical and why we must continue on those efforts, such as the behavioral health homes, where in the state we have the highest number of enrollees. Certified community behavioral health clinics, we have 2, in which we're working very closely with the state and with those 2 providers to make sure that those are huge successes and that there are no barriers for people who need services and supports. And then also looking at complex care coordination for individuals who are not assigned to a health plan. So we have individuals, what I used to call straight Medicaid. So those individuals often we're the only provider of care that they often know. So really making sure that we are focusing on managing care and providing services and supports for individuals who have not chosen to participate in a Medicaid health plan. We also want to look at improving systems of care. And so one of the biggest examples of that you'll see is our attempts to really work closely with our providers, but also we have put out a grant application hoping to expand a children's crisis service at the Common Ground or RCC, and we're still waiting to hear back. But we also have made an internal commitment that would be something that we would do. And we're trying to get the support of the county, of course, to really look at how we provide integrated care and improve the system of care for children and families. We don't want to hear those stories about families and children waiting in the ED for more than a day, or even in some cases, several weeks. There's a lot of backstory when we hear those things, but I never want to hear those stories. And we also have demonstrated our commitment to working with the hospitals by putting and promoting somebody in the hospital liaison role here at OCHN. And that person's job will really be to work with the hospital EDs and any barriers to getting to that next place where the person needs their care. That could be inpatient, that could be a diversion from jail or hospitalization, that could be a crisis residential unit where they could get services in a setting that is less restrictive than an inpatient hospital. But continuing to work with the state on these issues and making sure that the programs that they have set forth and chosen us to be a pilot for, such as MyCal, which is the statewide crisis line, we're really at the table hoping and wanting to see how these things are going to work for Person Serve. And the great thing about it is that including Person Serve in the delivery and design of those programs is going to be critical. The other priority that we're looking at is workforce development. And so we've come to you several times and talked about our direct service professional and the increased wages, but also we're doing even a step beyond that, in that we have submitted a proposal to the county about a program that would provide accreditation in college coursework for individuals in the direct service professional arena. So giving them a career path that would really justify, which I don't think we need a whole lot of justification now, but will really help to increase that pay rate. And we're also looking at licensed clinicians. We know right now it's a very competitive work market where people are leaving community mental health to work in other arenas where they can get paid more. So we want to be able to recruit and retain licensed master's level clinicians in the whole entire workforce so that we can provide the services and supports that we know individuals we serve need. We also know that we are facing some challenges with legislators. And just to give you a quick update on those two things, just this week, there's a survey sent out by Senator Shirkey's office, and I asked Sheila to send that to this board and as well as other staff to make sure that we're filling and giving information and giving feedback on his proposal. And then the other is Representative Mary Whiteford is doing listening sessions. And we were trying and still are trying to get a listening session with Mary here, Representative Whiteford here at OCHN, so that persons served can hear what she's proposing. We are going to participate, the leadership team and I are going to try to participate in some of the listening sessions that are being held. One is at Mork, I believe it's tomorrow, and there is another one at Detroit Wayne that they're hosting in the next couple of days. So as much as we can, we want to hear. And I know Ms. Newman also is participating in a work group where the peers are going to have a voice, hopefully have a voice to make known what their desires are for the service system. And so the rest of my report really just goes over on a high level about some of the things, the actual things that we're doing. And because I want to give you outcomes, I want to make sure that you're understanding we're aligning those priorities with actual work. And so that we focus in really on what we're doing for people. And so if there are any questions, I will stop talking now and I can answer those questions.
Any questions from board members? Remote?
Dina, just to clarify, this is Adam. Representative Whiteford is also speaking at Detroit Wayne tomorrow after Mork. So I think both of those visits are tomorrow.
Thank you, Adam. I know
Yes.
there's some limits to who can attend. I think Representative Whiteford wanted to limit it to 30 people, which in a way I find it problematic because I don't think it gives enough opportunity for people to really hear what the plan is and then also give feedback and ask questions. So we're really trying to advocate that we also have an opportunity to have a listening session with her as well. So Christine is on it and hopefully we'll hear something positive and we'll let you know as soon as that happens.
Are there more questions or comments from the board virtually? Not seeing any. How about here in Troy? All right, thank you, Dana.
Thank you.
The next item on the agenda is the public comment. Do we have anyone registered for public comment? This is our second public comment of the meeting.
No, we do not have any public comment this evening.
All right, thank you very much. Next is board member comments. Sheila, if you would go through our roll call.
Dr. Hans?
I have no comment.
Mr. Torres?
No comment.
Mr. Furman?
Yes, I just wanted to say that I really appreciated the presentations tonight. The story that inspires, as always, is inspiring, and thank you so much for Dr. Posius with the COVID update as well as all the other presentations tonight. Thank you and have a good night.
Miss Newman?
Thank you, Ms. Sheila. I'll try to keep it brief. Dana mentioned that I was working with a group of peers on a town hall meeting with Representative Whiteford. That took place yesterday on Zoom, and I was very, very pleased with the outcome of that meeting. I believe it's the first time that I know of that a legislator has accepted an invitation from peers, people with lived experience that work in the system. It was peers from all over the state of Michigan on that call. It was also shown live on Facebook. And she was very attentive to hear what we had to say. She took lots of notes. And I was, my mind was changed once I had an opportunity to talk with her. That doesn't mean I support what she's trying to do, but at least I respect a person that's willing to listen and is actively seeking the input of persons served by the system in the system redesign that she's advocating. After the committee of the whole, I attended our OCHN work group, advocacy work group meeting, where this topic came up as well. As you recall, those that were in attendance of the committee of the whole are lobbyists. I know that's not the proper name for him, but the gentleman that's working in Lansing on our behalf mentioned that there was not enough many voices of the person served being heard, like it was during 298. So I mentioned to Christine and others in the work group, and this is my personal opinion, I believe that when CMHs, PIHPs sponsor or gather persons served to speak, that they are dismissed by the legislators because they feel that the CMHs and the PIHPs are using us and giving us talking points, and I believe that it waters down our influence. So I told Christine that I felt like the work groups at OCHN needed to have an independent meeting, independent of staff, where we could come together and have a discussion and develop our own talking points, and Christine agreed. So there will be a work group meeting coming forth. They've already discussed it with all the work groups that are part of OCHN. I agreed to head up the effort. I'm not just trying to push myself out in the front. I'm thankful that people trust me to be able to carry the message, but I wanted to be a collective voice. I wanted to be the voice of all the persons served by this system, not just one population or another, and I believe that we will have more impact. So there will be more information forthcoming about this work group meeting in the next few weeks. And that concludes my comments.
Miss Root? Miss Namie Dyer?
No additional comments. Have a good night, everybody.
Dr. Guadalupe? I don't know if you're on mute, Dr. Guadalupe. Mr. Lindemeer?
No comments. Thank you.
Mr. Cowan? Miss Bernard? Dr. Taub?
No comment. Everybody have a nice, safe week.
Mr. Landsman?
Thank you. So I would like to just close with a couple of things for our board members and for the public who may be listening in. Be an advocate. Write and call your state senator, your state reps. Let them know the job that CMHs do for you, the benefit, the value that we provide, the measures, the outcomes, and how we track that. But also, FUD, fear, uncertainty, and doubt. Let them know that this doesn't happen when the money is spent on administrative costs and profits versus direct care, because that's what's going to happen if it's privatized and it's taken over by any one or number of payers. Some portion, maybe it's only 10% of the cost of the budget, but that's a pretty big amount. Some portion will cease to go directly to the folks that need it the most, the folks we serve. So it's important to get that message out, because when services don't happen, when people have crisis, it will cost the state more money than it does today when we handle those things, when we help them in their day-to-day lives. So it's important to sell the fear, uncertainty, and doubt that will happen if it swings that way, because that's what legislatures don't want to hear. That's what they have had to date with third parties, whether that's private or it's through a public solution, taking care of the people here so they don't have to. That's the history behind why we are an authority, so that the county didn't have to handle it. They turned it over, they delegated it to us to make sure that to make sure there weren't problems in Oakland County. And we've done a pretty darn good job to date. So we want to spread that message to the state legislators, to the reps, to the senators, to make them think long and hard about this before they turn it over to a privatized solution, whatever that may be. With that, I'll see you guys next week at our study session. Is there a motion to adjourn?
Mr. Landsman, Mr. Torres has his hand up.
Oh, I'm sorry, Mr. Torres. You're on mute.
Thank you. My apologies. I actually did want to mention we did have our Bylaws Committee meeting, our ad hoc committee. And I just wanted to give a brief update very quickly. On July 20th, we actually had our first meeting, and that was just basically setting the ground and getting information from Kalana and kind of setting a path as to how we would move forward, because as you know, this is a very tedious, comprehensive task. Then we had our second meeting on August 13th, and we began to review the bylaws. We went through the first 4 articles. A lot of the first 3 articles were things that were pretty much already, the governing law, the board of directors, the powers and duties of the board, a lot of things that we can't necessarily change per se through the bylaws. But we started to get into section 3.4, where we talked about orientation of new board members. We talked about specifically adding it be done within 30 days so that board members have all of that information early on into their tenure on the board. We spoke about board officer positions in section 4.1, discussed membership, talked about the difference between a chair of business operations and having a specific treasurer, board member terms, removal, vacancies, what to do in those situations. So we have a few questions out, and Kalana has been helping us with her legal expertise on some of those things. We'll be having our next meeting on August 25th from 5 to 7 p.m. And if anybody is interested in attending, it is a public meeting, and you can also speak in public comment. So the next meeting will be August 25th from 5 to 7 p.m. and we are doing those hybrid like we're doing the board meetings. Thank you.
Thank you, Mr. Torres, and I appreciate it. I didn't have you on the agenda only because we thought you were only at that storming and forming position, not in the activity, and it sounds like you guys are in action mode already. So that's wonderful to hear. They hit the ground running, yes. Okay. So now I'll take a motion for adjourn. Ms. Newman.
Before we adjourn, I just wanted to know, will they be sending out information about the next meeting if someone did want to attend?
I think I heard that it's on the calendar, so, or at least it will be now, right, John Paul? And you're on mute.
And I'm hearing an echo and I feel like I'm on mute. So, but we do have the information available and boardable. I know it's in our specific ad hoc group meeting committee. I'm sorry, I'm hearing this echo, so it's throwing me off. But we'll have that information available, and then we can make sure that it is a public meeting, so there is notice given. But we'll make sure that board members are aware if they want to watch or listen or speak in public comment as well.
Okay, and so like the other board sessions, we'll have board reports on it as well at each month. Okay, now a motion to adjourn. Thank you, Ms. Newman. Is there a second?
Second.
Thank you, Dr. Hans. Any discussion? All those in favor of adjournment say aye.
Aye.
Any opposed? There are no opposed. The motion carries. We are now adjourned.